Considerations for Special Populations During Disasters, produced by Catholic Charities USA.
Catholic Charities USA is the official domestic disaster relief agency of the United States Catholic Church.
Catholic Charities helps people, regardless of their faith, who struggle with poverty and other complex issues, and also helps these vulnerable people when they have been affected by disasters.
During disaster response and recovery efforts, Catholic Charities USA supports its local agencies in their efforts to provide resources and services to vulnerable survivors. Through training programs like this one, Catholic Charities USA also assists in building agency capacity to serve disaster survivors.
Considerations for Special Populations During Disasters focuses on helping those who may have additional needs before, during, and after a disaster in daily functional areas. These needs may include maintaining independence, communication, comprehension, mobility and transportation, supervision, and medical care. Children, the elderly, and persons with a physical and/or intellectual disability. People who are homeless or precariously housed, are undocumented, or those with limited English proficiency are all likely to need special assistance in disasters. Catholic Charities USA produced this video for local Catholic Charities agencies, Catholic parishes, and other organizations that may provide disaster services for those with functional needs. Part 1. Your Special Populations.
If you answer yes to any of the following questions, special needs population should be considered in your disaster preparedness planning. Does your organization
have residential services or day services for people with functional needs?
Have pre-disaster clients and/or their family members that will require ongoing assistance in disaster circumstances?
Have employees with access and functional needs?
Anticipate that community members with special needs may reach out after a disaster to Catholic Charities or the Church, even if they are not previous clients or members.
If so, this training will help you prepare by illustrating the higher risk and unique needs of special populations in disasters, discussing how to assess an agency's readiness to assist their special populations in identified high-risk hazard events, providing examples, and suggesting resources for addressing gaps in that readiness. The participant guide that can be downloaded with this video includes a summary of the video content and links to helpful resources. Part 2. Disaster Risk for Special Populations.
In this training, a disaster refers to a sudden calamitous event that seriously disrupts the functioning of a community or society, and an event causing human, material, and economic or environmental losses that exceed the community's or society's ability to cope using its own resources. Catholic Charities agencies determine what hazard events and vulnerabilities they must plan for by completing a risk assessment, a process described in the online training, Understanding Risk.
Some natural disasters affect us with little warning, like earthquakes, tornadoes, flash floods, and wildfires. When a warning siren or a text message is the first indication of an impending event, or when the ground begins shaking or the wind is blowing, there is no time to develop a plan for protecting those with functional needs. Consider that the average age of those who died in the 2018 Paradise, California campfire was 72, and many were disabled or in poor health.
Other disasters like slow-rising river floods, hurricanes, heat waves, and blizzards develop slowly or are predictable. They do provide more time to consider agency options for assisting special populations during and after the event, as long as a basic plan is in place.
Still, predictable events may become unpredictable, and any disaster event is more likely to negatively affect people in special populations. A 2015 Health and Human Services report notes that during Hurricane Katrina, older adults and people with disabilities were among the hardest hit. 71% of the people who died in the state of Louisiana during the storm were over the age of 60.
The impact on special populations is worsened further when the services and supports normally provided to them are also interrupted. It is important for community-based organizations like Catholic Charities agencies to be able to reopen as soon as possible after an emergency.
Risk factors to consider. This list, excerpted from the U.S. Department of Justice publication, Making Community Emergency Preparedness and Response Programs Accessible to People with Disabilities, describes many of the reasons why special populations are at greater risk of disaster impact.
Notification. People with hearing impairments may not hear audible warnings. Visual alerts will have limited to no effect on persons with low vision or blindness, and people who are poor and homeless may not even have access to TV, radio, or cell phone warnings. Non-English speakers may not understand notifications, and newcomers to the United States may not realize the potential for destruction of the disaster types referred to in the warning.
Evacuation. Those with limited mobility, or those who use aids such as canes, wheelchairs, and walkers, may not be able to physically evacuate without assistance. People with cognitive impairment may not understand what is happening or what is required for them to evacuate.
Emergency transportation. People with physical disabilities and/or limited mobility may need others to transport them, and specialized vehicles may be required. Those without transportation may have no choice but to travel on foot.
Sheltering. Temporary facilities, including shelters, may not have accessible parking, entrances, or pathways to maneuver through the temporary facility, accessible restrooms, staff or volunteers trained to meet the needs of people with disabilities,
Access to medications, refrigeration, and backup power. People who are medically fragile may need access to electric power to use for life-sustaining medical equipment, to charge communication devices, or to refrigerate medication.
access to mobility devices or service animals. When transportation space for evacuation is limited, some mobility devices might be left behind. For example, a large electric wheelchair used daily and adapted for a person's specific needs may not fit in the transport vehicle. Only folding wheelchairs may be available for transport and for mobility within the emergency facility. Some people with mobility issues may not be able to operate non-electric chairs without assistance. Staff providing transportation or emergency shelter may not be prepared to accommodate service animals or understand that a no pets rule does not apply to trained service animals.
Access to information. In recovery centers or points of distribution or other emergency facilities, people with vision impairment will often not be able to read informational brochures. Those who are deaf will not hear announcements. Those with limited English may not understand either written or broadcast information, and people with communication disorders or limited English may not be able to express their own needs.
Activity: assessing special needs risk factors. The participant guide includes a checklist of special needs risk factors. It can be used to identify which factors may affect your current or anticipated special needs clients in a disaster. Either pause the video now to complete the checklist or refer back to it at a later time. Part 3. Planning to meet the needs of special populations in disasters.
Catholic Charities USA offers tools to help assess overall agency disaster operations preparedness. The pre-disaster assessment tool includes a section on vulnerable populations where information about your special needs clients can be recorded. The Catholic Charities USA video, Developing a Disaster Response Strategy, provides scenario-based training on the use of the pre-disaster assessment tool. These and other tools are available through the Catholic Charities USA member portal or by contacting Disaster Operations at CatholicCharitiesUSA.org.
The first step in the assessment and planning process is to find out what hazards might affect your agency and the community it serves. If further analysis indicates that your vulnerable special populations may be affected by those hazard risks, there are some important questions to address before an event occurs.
Do you have staff or volunteers who can communicate through sign language? Speak the language of non-English speaking people in your community? Can work in mobile teams and provide house-to-house assistance?
What type of equipment do you already have? The answer to this question will vary widely depending on your outreach and existing programs. For example, do you have access to text telephones, known as TTY, that allow people to speak to others and read their responses in type? Phone amplification?
Do you have communication boards, charts, or other materials that people can use to communicate without verbal speech? Computers with communication and other adaptive software?
If needed, would you have access to mobility devices, wheelchairs, walkers, or canes, agency vans or cars?
Are you coordinating and planning with community partners? Do you have the information sheets with police, fire, and ambulance phone numbers? Community shelter information? Other emergency information specific for your area?
Do you have partners with specific capabilities and resources related to the special populations in your community? Consider that many local Easter Seals affiliates have equipment loan closets to support a variety of long and short-term disability needs.
Are you coordinating as needed with local parishes and social ministries?
One agency that has addressed the special circumstances of disaster planning for their special needs populations is Catholic Charities of the Archdiocese of New York. This federation of more than 90 human service agencies provides help and creates hope for hundreds of thousands of New Yorkers in need, non-Catholic and Catholic alike. Its Beacon of Hope division provides a continuum of housing opportunities to people struggling with serious mental illness.
The agency's evacuation plan for Beacon of Hope facilities includes 4 major elements. More details are included in the participant guide. Finding additional options to house residents during an event where there is advance notice. Confirming evacuation details and transportation. Deploying agency staff to the evacuation site during the period of relocation. Returning clients to the residence when local reports indicate it is safe.
At one time, Catholic Charities of the Archdiocese of New York also offered services for the blind. Their disaster preparedness guideline for this population is also included in the participant guide. Activity: accommodating individuals with access or functional needs in a disaster. The participant guide also includes a checklist to assess your current resources for assisting those with access or functional needs in a disaster. If you have time, pause the video now to complete the checklist. Identify where gaps may exist. Part 4. Next steps.
Seek guidance if needed. If your assessment reveals that the needs of your special populations cannot be adequately addressed in a disaster, Catholic Charities USA and several agencies in the U.S. Department of Health and Human Services may be able to provide resources. The links are included in the participant guide.
To define, locate, and reach special, vulnerable, and at-risk populations in an emergency was published by the Centers for Disease Control and Prevention. It provides information and materials for emergency preparedness planners to better communicate health and emergency information to at-risk populations for all hazard events.
Planning for Access and Functional Needs from the Substance Abuse and Mental Health Services Administration contains information on how to work effectively with community members with access and functional needs before and after a disaster.
The U.S. Department of Health and Human Services also produced Ensuring Language Access and Effective Communication During Response and Recovery, a checklist for emergency responders. It includes recommendations, actions, and practices to address the needs of persons with limited English proficiency and persons with disabilities affecting language access and effective communication.
Help others help themselves. Also consider that your agency's case managers can help special needs clients identify their own requirements and those of their families. Ready.gov, a federal emergency management agency website, contains an array of resources to identify such needs and plan for emergencies.
If clients need additional help, case managers can assist clients with their emergency planning, helping them with items such as compiling a list of emergency numbers of people who can act as a support network if a disaster occurs, as well as local fire and rescue and hospitals. Working with local services, public transportation, or paratransit to identify accessible transportation. Identifying items to include in emergency go kits, such as medications, special foods, and batteries for various devices for individuals with disabilities.
Catholic Charities staff needs can also be documented and kept on file to ensure that their special requirements can be met.
Wrap up. Contact Catholic Charities USA for resources and training opportunities that will assist you in building your agency's ability to meet the needs of your special populations in disasters and to improve overall capability to assist the poor and vulnerable to respond and recover. Email us at disasteroperations@catholiccharitiesusa.org or call Catholic Charities USA at 703-549-1390.